Thanks, Carol. I was just going to say we're recording this webinar. So our team has been out in the community helping support some of the communities we've with vaccine administration. And we wanted to, just share some messaging and some lessons learned, and then give some information on, the vaccine clinic. Because we know everybody's dealing with outbreaks right now, and they're busy with that. And sometimes, we sent everything by email, but I know we're so busy, we don't open up all that email. So we wanted to have a webinar so that you're aware that, you have your readiness before, you get the vaccine. And Casey is the one that will let you know when it will be delivered to your community, and he is a logistics guy. So we just wanted to make sure that, everybody's ready and good to go, and that we can support, our team can support if you don't have enough nurses, but we do have to book that. But, Lisa, our regional executive director in the interior, has us dedicated to you for us to help until the end of March. So just giving you the heads up on that. So we might as well get started here. Okay, next slide, Carol. Okay, so today's our vaccination clinic goals. We want to reduce the incidence, prevalence of vaccine preventable illnesses in communities and improve health status of our communities. So we've always had the CHNs in the community providing the vaccine. But this is a mass clinic, and we want everyone to be like, start it now, start that planning, be ready, because we only get 7 days to hold on to that vaccine, because we have to move it to the next community. So I would say that, 2 to 3 days is, good for a clinic, depending on the size of your community, because we want them all to be the clients in the community, and to have them at similar times for that second dosing. So of course we want, cultural appropriate and trauma-informed practice for these clinics and our communities. We want impeccable storage and transport, and safety, efficiency, and learning and evaluation. Next, Carol. So what we're going to cover today is messaging, the COVID-19 vaccine, site setup and flow, staffing your clinic, and supplies for the clinic, documentation, where Michelle Ham will come on, I think on in about a half an hour, and answer questions. Okay. So some of the main, yeah.
Before you continue, are we able to get a copy of your presentation so that we can provide it to our leadership so I don't have to take notes?
Yes, we're hoping, well, it's recording right now, so hopefully we can send it out. Yeah, we're still working on that piece, but when it's recorded, we should be able to share it out. We did mention this at our nurses meeting yesterday, all nurses meeting in the province, and a lot of other regions wanted this presentation because they haven't created it yet. So we would love to share it with everyone.
We should be able to share the slideshow as well.
Yeah. Great question, thank you. Okay, so a lot of the messages, you'll kind of hear us throughout the whole presentation that we want you to kind of, you might hear them twice. It's just things that we thought about that we needed just to share. And for messaging, we want communities to be excited about getting the vaccine. And that's kind of hard. We know that's hard to, for people, they're afraid and there's hesitancy. But what we did, in Lillooet, there was videos of chiefs receiving the vaccine and posting it on YouTube, which was helpful, and then when we actually give the vaccine, we say, I say that I've received it and it was sore for a couple of days, but we it's going to help us and, protect us after a couple of weeks. And we'll give you more information on that. Also, yeah, so we're just trying to get, buy-in from the community. This is good. This is what we need. And we can explain more about the COVID-19 vaccine. And we have Moderna right now. Next. So we want to build trust with our members as well. Messages for the clinic is I already mentioned the urgency, but we want to make sure that everyone has their PHN. Bring it along. It's so much easier when we do our forms, when we're checking people in to get that information so we can get those records completed. Some protocols and directions, for coming into a building. We'll explain that more, and it should be a one-way, a different direction. Some people may have to wait outside in this weather, and right now here it's winter wonderland. So we want them to stay in their cars because we want them to keep their distance. Have a short sleeve. I know in some clinics, some people had to take off their whole shirt and, and if you're in the gym and you're with a lot of people, you don't want to be taking off your clothes. We want to give you some privacy. And then after we'll have they'll have the 15-minute observation just in case an anaphylactic reaction. We did have a recording of the webinar that we will share for anaphylaxis that we provided to the Lytton and Lillooet area since they were one of the first communities. So we do have that and we need to share that out to everyone as well. So also for appointments versus drop-ins, we're recommending that you book appointments unless you want to have a certain time frame where you can just have people drop in between a certain, like 5 to 6 people in case some people cancel. So of course we want to protect our elders and community members. Next. And this is just previous Chief Daryl Bob from Hufflick, and he is, having a ceremony before for the vaccine, recognizing this is something in history that's, that may not occur again, that we want to document this time and make it something that that we're proud that we were able to, live through this and be resilient. And we recommend that there is some kind of ceremony, but it's up to each community, whatever they want to do. And next, I'm going to pass this over to Natasha.
All right. Thank you, Pam. That was great. Hi, everybody. I'm Natasha Hatendi. I'm a community health practice consultant with the Interior Regional team. And previous to that, I was a community health nurse in the Lillooet area for 6 years. And I'm originally from Newfoundland, and my dad's from the Halibu Mi'kmaq band there. My mom's a settler, and I live and play here in Lillooet on this beautiful Northern St'át'imc territory, and really happy to be here with all you guys today. So I'm going to talk about this section, the COVID-19 vaccine, and then I'm also going to be covering the rest of the documentation section after Michelle Ham comes on. So before we get into this section, I just wanted to talk a little bit about vaccine allocation because we get a lot of questions about that and about how that's determined. So the way that the vaccine is allocated and determined is from the census numbers that Indigenous Services of Canada, they're online with the census. They are a little bit dated. So in the interior region, those numbers are cross-checked with the leadership in the community. So that might be the health lead or the chief, or might include the nurse as well. It depends on the community. And then it's also assumed that there's going to be a 90% uptake. That is a very optimistic, probably. I don't think we've seen that high of a numbers, but that's the numbers we go on, and it gives a really nice number of vaccines that would be going out to your community. It's not a perfect science, but it's based on the best available data. And I also just wanted to touch on as well, because this kind of came up too, about the messaging around the Moderna first and second dose vaccines. There was some confusion about the first dose being 70% effective. What we understand from Moderna is that the first dose is actually 92% effective, and that efficacy is gained by the 14-day period. And the reason for the second dose is it gives that long immunity, because the first dose is only going to cover you for 6 weeks. So, and then the second dose is going to boost that immunity to give you a little bit of a longer coverage and bring it up to 95%. So I hope that makes sense. All right, so next slide. So again, very exciting when you hear that the vaccine is going to be coming into your community. So when the vaccine arrives and you know that it's coming, there's going to be some coordination of the vaccine. So this could be with First Nations Health Authority or the Regional Health Authority. They could be either one or the other could be delivering it to your community. And that is again happening through Casey with the Interior Regional Logistics team. So they're going to reach out to your community health practice consultant, the nurse, and or the health director to kind of figure out everything around this and how the vaccine can be delivered. And then the person who's receiving the vaccine is going to need to ensure that everything is safely followed and that the cold chain is maintained and everything. So the product could be thawed or it could be frozen. It kind of depends on what you're getting, and you will know that. And it's going to depend on what if you have a fridge or a freezer as well, and how much space that you have. Important to remember again is that it will take about 1 hour to thaw for the vaccine at room temperature, and then it takes 2 hours and 30 minutes to thaw in the fridge. So just keeping that in mind, if you're planning to run a clinic right away, you might need to thaw it at room temperature for the ones that you want to use, and then being aware that once it's at room temperature, it's good for 12 hours when it's on open vial. So you don't want to take out any more than you need. And then for the ones that are frozen, the probably best idea is to take it out the night before and just put it in the refrigerator for the doses that you're anticipating to need for your clinic on the next day. When you do start to use your vaccine vial, you're going to want to swirl it just to make sure, because it does settle when it's frozen or when it's sitting, and you do need to make sure you swirl it and not shake it. It is very it's not a very stable vaccine, so you got to make sure you handle it very carefully. And then also a reminder to not refreeze those vials. And next slide. All right, so planning in advance. So this is this is kind of a little bit of a to-do list for you guys. For those of you who have no information on when you're getting your vaccine, it is going to be coming. And this is some things that you can start looking at right now. So availability of a fridge. This is for the cold chain. Your fridge freezer capacity. Is your fridge set up properly? Do you have a data logger, a min-max thermometer? Do you have a daily monitoring process? And if you don't, because you don't normally administer vaccine and you're just doing the COVID vaccine, this might be something you want to ask your community health practice consultant about, or the immunization team at FNHA, to kind of figure out what this entails. And then a backup battery generator. Is that something that you need or have? All right, next slide. All right, so I just wanted to put this picture up here. It is just an image of the Moderna vaccine, and the Pfizer vaccine comes in a little bit of less doses in a vial. I think it's 5 to 6 doses. And but I just wanted to put this here so you have an idea of what it looks like and how much vaccine is contained in this box. So this box here would contain 100 doses. So very small footprint for your fridges, and will fit in most of your vaccine fridges, even if you have a small capacity one. All right, next slide. So I wanted to talk a little bit about cold chain, and I know a lot of this information about cold chain and refrigerators, it might be really familiar to those nurses on the call that are regularly immunizing. We do have health directors on here, and you might also be familiar with this information, but we wanted to just reiterate this stuff because it's really, really important with the COVID vaccine to make sure these things are in place. So a cold chain refers to the process used to maintain optimal temperature conditions during the transport, storage, and handling of vaccine. So this cold chain would start with the manufacturer, and then it would end with the administration to the client. And then the recommended storage temperature for the vaccine is 2 degrees to 8 degrees. And then there's a suggested to maintain a temperature of 5 degrees if possible. So maybe setting your refrigerator to 5 degrees is a good kind of temperature to set it at. So you have a little bit of buffer on each side of that. Next slide. All right, so we want to talk a little bit about refrigerators as well. So not all refrigerators are good to keep vaccines in. It is ideal to have a purpose-built refrigerator, so a vaccine
We're missing stuff for
fridge.
I'm giving the injection. Okay.
I feel like this is kind of just like the.
Somebody needs to go on mute. Brittany.
Oh, sorry. Oops.
Okay, perfect. Thank you. Yeah, so it would be ideal if you have a vaccine refrigerator to use for this. And then if you don't, a conventional refrigerator is good, but it's going to need certain protocol to set up in order to be able to use that. So if you are using a regular standard refrigerator, please reach out to the immunization team so you can figure out how that has to be set up. Oh, yeah, I'm not finished that one. And then it's really great if you have a glass door in your refrigerator so you don't have to open it whenever you need to do inventory and all those kind of things. Things that are not acceptable is a bar-like refrigerator that those do not have the ability to maintain the cold chain. So you cannot use those. And all of these things are going to be cross-checked before you get the vaccine anyways, but just in case you haven't had a conversation yet. Another thing important to do is to put a do not unplug sign next to the plug-in of the refrigerator. And it's a good idea as well for the breaker on the panel to write do not disconnect. And this is just to really ensure the safety and the cold chain of that vaccine. Next slide, please. All right. So with your refrigerator, there are some do's and don'ts with the storage of the vaccine. So when you have a vaccine fridge, or if you're using a domestic refrigerator, you should not be storing food or beverages in that refrigerator at all. It should only be designated for vaccine for your biologicals. First to expire, first out. With the COVID vaccine, you're going to be getting the same lot and it's going to have the same expiry date. So this wouldn't really apply so much to this situation. It would just be that your vaccine is there and that you know where it is. So you're going to want to clearly label biological products that have a cold chain incident and those that are deemed unusable. So the refrigerator should also be in a well-ventilated area. So lots of airflow around. You're going to want to look at your manufacturer's instructions to make sure that there's no blockage of the vents, that the vents are dust-free. And it's a really good idea to get your refrigerator serviced once a year to make sure it's functioning properly. And it'll also increase the longevity of the refrigerator. And if you haven't had it serviced in a really long time, maybe if you're not getting the vaccine anytime soon, or if you haven't heard, it might be a good idea to get it looked at just to double check everything is up and running. And then keeping the refrigerator out of direct sunlight. As you know, most vaccines are sensitive to light, and this includes the COVID vaccine as well. Again, putting it on its own electrical circuit. So that means having a plug in the wall. Don't use that plug for anything else other than the refrigerator. That's just in case you don't want to blow the fuse. And then don't store the COVID vaccine on the door of the refrigerator if you have that option, because that is outside of the cold chain. If you have a large refrigerator, or if you don't really use a lot of vaccines in your community and there's space in your vaccine fridge or domestic refrigerator, you're going to want to fill all those spaces with water or water packs just to keep the temperature. If the refrigerator were to go off, this is going to help to maintain the temperature inside the fridge to that cold chain. You're going to want to check your temperature log twice daily. We're going to talk a little bit about that. And then also, you're never going to want to leave the vaccine outside of the refrigerator. Of course, with the COVID vaccine, it is stable at room temperature for 12 hours in an unpunctured vial again, and 6 hours once the vial is punctured. So there is a little bit of wiggle room with that, but don't take it out unless you're going to use it. And if you are towards the end of the day, we recommend like sharing a vial between the nurses and stuff like that. All right, I think that's it for that one. So you can switch to the next slide. So monitoring your refrigerator is really, really important. And this becomes really important if there is a cold chain break in your vaccine. So the first thing you have to do is to make sure that you have a paper log. So this is at the start of each workday, you're going to record the temperature on the form. So current refrigerator temperature, the maximum and minimum refrigerator temperatures, the dial setting of the refrigerator. So this means what the fridge is set to, so what you have it set to, and then the current room temperature and the time the reading was taken. So important to include all of these aspects. In a lot of communities I go into, I only see like the temperature of the fridge and there's no time and there might not be the room temperature, but all of these parts of the daily recording is important. And you'll find out the hard way if you have a cold chain that they're going to want these pieces of information, because they'll want to look back at the trend of your refrigerator. So important to do this paper recording, even if you are using a data logger, because the data logger could fail, and it's also, the data logger is something you're only going to do once in a while. It's not something you do daily. I just see somebody is not on mute. Thank you. All right. And then when you do check your temperature, you're going to want to reset your min-max thermometer so that it is reflective of the next time period that you're going to be looking at. And then retain these forms, have a file section in your file cabinet to keep these forms. So the other way of recording, and is highly, highly recommended, is a data logger. Sometimes they're smart buttons, or they might be like a little bit of a USB device. And they go inside of your refrigerator and they record the temperature over a long period of time. And you would take them out. Usually some places take them out once a month. They plug them in and they have a look at the temperature recording, or maybe you do it after the weekend every week on a Monday morning to look at the temperature. We are recommending that if you are storing COVID vaccine in your refrigerators over the weekend and you're not providing clinics over the weekend, that you do take this data logger out and just have a look at those numbers on the Monday morning, just to kind of make sure and assure that it's not broken the cold chain. Yeah, and if you need information about data loggers or devices like that, then you can reach out to your community health practice consultant or the immunization team, and they can send you some really great ideas for products for that. All right.
Sometimes the power goes out too. So if there's somebody that, we have to monitor the fridge still, that somebody should be monitoring if there's a power outage, and that you have to get that vaccine to another place, because we want to keep it and we don't want it to be wasted. So there should be procedures for that as well.
Thanks, Pam. All right, so next slide. All right, so what is a cold chain incident? So a cold chain incident is any temperature outside of that 2 to 8 degrees range, and it requires immediate action. So exposure of a vaccine to 0 to 2 doesn't constitute a cold chain incident, but it does need to be taken into account and it needs to be responded to right away. Next slide. So when you do have a cold chain incident, what you're going to do with the vaccine is you need to now determine, is this vaccine usable? So it's going to depend on so many different factors. And that is going to be like, how long was it exposed? What type of vaccine is it? With the COVID vaccine, it is, again, very prone to going bad, and it's not a very stable vaccine. It doesn't have any preservatives in it, and it doesn't have any adjuvants in it. So it's not good if it gets exposed. So you're going to need, the first thing is you need to contact the FNHA and your local public health unit to get some guidance on this. But if you're not able to get a hold of them right away, you're going to want to write do not use on it. You're not going to use that vaccine with the date and time. You're going to place it into a container in the refrigerator, and you're going to try to return it to that 2 to 8 degrees as soon as possible. And then if you don't have a refrigerator that's available, then you can put it into a cooler with ice packs and monitor that with a smart button or a data tracker or a min-max thermometer. So when you do have a cold chain event, you're going to want to keep good records of this. So on the temperature record, you're going to want to put your date and time and the following 4 temperatures. So your current fridge temperature, the minimum, and then the maximum, and then the current room temperature again. And then again, you're going to fill out this cold chain incident report form, and you're going to refer to your regional health authority as the ones that deal with the cold chain incidents. But because FNHA and regional health authority work together in First Nations communities, they will need to know as well, and they're going to be involved in the process of recommending, especially around this vaccine. Yeah. So just wait to hear back from them, and then you'll decide what to do with the vaccine based on what they say. So next slide, please. So power outages. So this is really important to prepare for, because this does happen, and it did happen already with this COVID vaccine in one of our communities. So you want to avoid having wastage of vaccines. So you're going to want to have an emergency office specific plan for a cold chain break and for the power outages that could occur. It is winter, so expect power outages, and you want to identify on that plan somebody who's going to be responding. So maybe you have somebody that responds at the health center when there is a power outage. That person needs to know to notify a nurse, preferably, to go and check on that vaccine. And it doesn't matter if you have a generator or a backup battery, somebody should still go and ensure that that vaccine, that backup battery or generator has kicked in. So, and then also you're going to want a backup person for that person as well. So have somebody on standby who responds to power outages to ensure the vaccine is safe. And then if that person is not available, then a secondary person to go check on that vaccine. And to have the information or some sort of policy procedure. And we can help you with that if you need policy procedure, and the immunization team as well, about how to respond to that. So once you have a power outage, in that emergency plan, you're going to want to identify a backup refrigerator. That could be somewhere in a close by community, or it could be in a city that is nearby that you can bring that vaccine to. Again, with the COVID vaccine, you can't move it without getting approval first. So just wait for that information before you move it. And then on the temperature report form, same thing as a cold chain break, is when the power goes out, you're going to want to write down your minimum, maximum, and your current, your room temperature and time. And then you're going to want to reset your thermometer and keep a really close eye on that. And then this time you're going to place a do not use on the entire refrigerator, because everything has been exposed in that refrigerator, and you're not only going to have to deal with your COVID vaccine, but as well as your other vaccine as well is going to need to go through a cold chain break process. If the power is expected to be restored in a few hours, they might not ask you to move it or anything, but again, just wait for their guidance on what to do. And And then you're just going to want to keep a really close eye on the refrigerator. So you writing down when the temperature is going up. So you have a really good record to provide to FNHA and the Regional Health Authority of the times that the lowest temperature it went down to, or the highest temperature went down to, up to, sorry. And so that they have a good idea of what to do with that vaccine. All right, next slide. So again, moving the vaccine. So open vials cannot be moved. Decisions to move to another site comes from, I got MOH, it's MHO, sorry, the medical health officer and FNHA, they would make those decisions. So just say you got 300 doses for your community and only 150 people want it in your community. That doesn't mean that that vaccine is necessarily going to stay there and it belongs to that community now. The vaccine gets to stay in the community for 7 days, and then whatever's not used, it needs to be moved very quickly to another community. There's not a possibility to use it for the second dose, because as you know, the second dose would be the earliest at that 30-day mark. And if you're cracking open, if you're using a thawed vial, it's only good for those 28 days. So it's not going to line up well for the 30 days, sorry. It's not going to line up well to get those second doses. So that vaccine is going to need to move on, whatever's not being used. And it is not recommended to offer those vaccines to members that are off reserve, or to invite people from cities or Vancouver or whatever to come home for the vaccine, because the vaccine is meant for the on-reserve community members, and we don't want to increase the chances of outbreaks and stuff in community. So just so you're aware of that. And then we're also still trying to figure out the logistics and stuff behind home visits. There is some talks around that, and that is still being determined, and we will keep you guys updated on any information about that. So next slide. So this is just some resources on vaccine storage and handling. There is a nice little course that you can access at this link, and I would recommend having a look at it because it goes into a little bit more depth. So that is it for me, and I'm going to pass that on now to Carol.
Thanks, Natasha, and thank you, everybody. My name is Carol Michelle, Community Health Practice Consultant for the Interior Region. So I'm going to be talking about the site setup and flow, what supplies you're going to need, as well as a few other sections. So let's get started. For site setup and flow, things that you need to consider when you're choosing your site. So I think it's really important just to know what is your population size and for your community. And that's with people that are living in community and their spouses, and if there's a community member has somebody from another community living there and there's their spouse, they should be also included in your population. And also thinking about the people who work at in the offices in the health in the community are also part of your population. So keeping those things in mind. In the interest in the vaccine, the COVID procedures, the number of immunizers, usable space and community. So thinking about this is just a couple of pictures that Shauna had sent us when she was in one of the communities. And in the first picture, you'll see, actually, let me just go back. I think I missed a few things. Nope. Yeah. So in here, you'll see this is the entrance into their building, and it's basically looking at, you have a reception area. This is where people will go in and check in, and they will also get registered onto for the e-forms, and that's when the e-forms will be drafted. Then somebody could be, one of the volunteers could either direct them or bring them into the site where they will wait until the nurse is available. Just another couple of pictures showing setup. This is, of course, in a larger setting. And in the far side of this first picture here is, these are privacy screens. So there was some, when they were there, they had a couple of people that didn't quite come prepared with short sleeves. So just making it sure that they're, they're maintaining their dignity as well. And in the second slide, you'll see this roped off area is actually a waiting area. And the chairs are proportionally distanced just to maintain their safety. There's people would, after they got their vaccinations, will go here and they'll wait. And there are timers that were sitting here designated for this, as well as in this setting, in this time, there was a local physician who was actually volunteering her time to support the COVID rollout. And she actually was in the waiting room, just monitoring for any changes or any signs of anaphylaxis within the community members that were there. And it's really important, whoever's going to be monitoring their waiting room area, they should have some knowledge on what to look for and who to call. And here's just another graphic on flow. So you're coming in through here, you're going to reception intake, they'll direct you to the waiting area. In the center of this diagram, it depends on the size of your community and the size of the space that you're using. Ideally, you want to be able to use a larger setting, because your vaccine is, like Natasha was saying, you're only getting it for a short period of time, like 7 days. And depending on the size of your community, you want to try to get this done as fast as possible. So you need to really think about that setup. If you have a number of nurses, then you could actually have somebody who monitors all the logistics of this. So this person will be making sure that you have your setup and your flow, and assign people to the different situations, whether that's with the reception, whether that's a waiting or sanitizing, and also to who is responsible for the vaccine. If you may have that one person may be the one that is bringing the vaccine to each of the nurses at the tables. And here you see that there are 3 tables that are set for with vaccinating nurses and the observation area. So in some of the smaller settings, you also have to consider the fact that you may not have this. But what is the best way that you could support communities for that? And so whether you're going to be offering this through your health center, you need to watch the flow. You have an entrance and an exit, and they shouldn't overlap. And making sure too, if you're going to have that, where's the waiting areas going to be, and who's going to be sanitizing that? So staffing for the clinic. See if I make sure I cover my notes too, see if I got everything.
I just wanted to mention that we're also having leases, leases providing funding for some food and snacks for the clinics, to give out granola bars or a juice or something like that as well, as an offer to, just to give to these clinics as well.
Thanks, Pam. And it's also really, and also to think about who are the people in your community, right? So like I said, you have a clinical lead, and that would preferably, ideally be the nurse in the community that knows the community, that knows the people in your community. You'll have greeters, the registration, immunizers, monitors and keepers, other support people, and those that are, supporting making sure that everything is cleaned after everybody. So with your clinical lead, like I mentioned earlier, they're organizing and planning the site. They're doing the setup and the flow, and they're setting the assignments on who's the best person to be in your registration, who's the best person to be your greeter, and they delegate those tasks. They address any of the issues that may arise in the community, and they can basically help with it, identifying any, solving any of those problems. See what else. And they know the community. your greeters. Like these could be volunteers that you have that want to just be a part of this, because this is definitely something that doesn't happen every day, right? So they may be really keen on wanting to be a part of the whole help. So they could be the screeners, they could direct clients to where they need to go, whether once they get the registration, where the waiting areas are, or which nurse to go to, depending on how many nurses you have there. And also they could be staff members at the health office or the band office. It all depends on, you know, who is interested in that. Registration. I think with registration, it's really important to think about, like, what is your what is your population base? How many people do you feel are going to be wanting to get this vaccine? And it's really important to start thinking about that now and getting those lists developed already. And you really want to make sure you have confirmed appointments, whether that's appointment times or appointment blocks, and having enough people show up in that appointment times, and having a backup as well. Because one of the things that we've found is that some of the communities, they had appointment times set up, but then there was a little bit of hesitation and then they never showed up. So who else could fill in for that spot? So keeping that in mind, and just having a, or even asking when you're booking the appointments, if I need you to come in earlier, can I call you? Just so that they know that they may come in sooner than their appointment time. The registration will start the e-forms, as well as they'll direct clients to the nurses. And like, again, those are the staff members or the volunteers. Sorry. Monitors and timekeepers. This is really important, only because we, with the COVID vaccine, it is a new vaccine, and we want to make sure that everybody who gets the vaccine is safe. So once they got their vaccine, they need to make sure that somebody's keeping track of those 15 minutes. That's where they can be handing out the snacks. You need to ensure that wherever this is, you maintain the social distancing. The chairs are sanitized after every client leaves that area, and it should be staffed by somebody with a health background as well, ideally, especially if you're going to be monitoring for anaphylaxis, just making sure everything is okay. Other support people that you can have, there's interior health, and it's been actually really good with interior health. Before vaccines are going into community, there's always these planning calls that have been set up by logistics teams and Pam, and sometimes we're involved in that as well, including interior health. So if you find that you're the only nurse in community and you have a lot of community members, who can we rely on to come in? You may have an interior health nurse, you may have a local physician who may want to volunteer, community paramedic, pharmacist, because I know that in the Northern Saskatchewan, actually there was a couple of pharmacists who volunteered their time and went out to community and offered the vaccine. So see who is out there that you could potentially, pull in and ask them if they want to be a part of this, because that it is a once in a lifetime too, and it is of urgent to get this done as fast as possible. We have also been brought a picture of us here. We were in one of the communities, and we went out and we're all immunizers, and we went out and supported a couple of communities to do their vaccine rollout. And also think about any kind of relief staff or people on standby. So supplies for your clinic. I'm trying to slow down, guys, sorry. So what will you need? So first and foremost, you're going to definitely need some PPE, right? Injection supplies, anaphylaxis kits, laptop, signage, and resources. So Natasha put together this really cool little graphic of supplies that you're going to need. So for the greeters, if they're 2 meter distance from the community members, they'll only need to wear a mask. If there's less than 2 meters, they'll need mask and eye protection. Same with registration. If there's a physical barrier or there's 2 meters distance, only a mask needed. If there's no barrier or no physical distance, and a mask and eye protection should be advised. Immunizers, there is no chance for physical distancing. So you're right up next to there. So immunizers are definitely going to need a mask and eye protection. Some have been using gowns as well, but it all depends on your own personal choice, I guess. Immunizers, clients on isolation. So that actually happened in one of the communities. It must be done in a separate area, in a separate room, or even if they drive up in the behind the in the back and they stay in their vehicle and they get immunized in their vehicle, if there is no room that they can sit in. And they must stay in that room that they get immunized, or they must stay in their car. And making sure too that the client is asymptomatic. And as for PPE for that, it's basically your mask, your eye protection, your gloves, and your isolation gown. And the monitors, I should be wearing the mask and the eye protection. So really take stock of what PPE you have on hand right now and ensuring that you have enough for your clinics. Injection supplies. So I know over the last months, we're working up to this, we've been encouraging our nurses to really order your supplies, order your syringes and your needles and everything that you need to provide for the clinics. I know that also there are supplies, auxiliary supplies that could be sent to you prior to this, and it will include all of this as well. I don't think it has the cotton balls in there, but it does have the syringes and the needles and alcohol swabs, Band-Aids and sharps containers. But making sure that each setup that you have for each nurse has all of that. Anaphylaxis kits. So another thing about the anaphylaxis kits is you really need to make sure that you think about how many immunizers do you have there, how many kits should you have. So if you have 2 or 3 immunizers, you should have 2 or 3 anaphylaxis kits. Ideally, you want to make sure that they're all fully stocked. You check the expiry date. You have an up-to-date BC CDC guide that is, I think it's June 2019. Is that correct, Natasha? Yeah, June 2019 is the latest. So making sure that you have that and it's printed out and it's right there with your AnaKit. And if needed, take the refresher course, which is on the Learning Hub on managing anaphylaxis. There are other webinars as well. And if you can get onto the gathering space, if you need support getting onto the gathering space, you can reach out to your practice consultant and we will help to connect you. For the nurses and the registration, laptop is needed. So depending on how many people are registering, you may need 1 or 2, ideally, just to make sure that they get the e-forms drafted. Each immunizer needs to have a laptop beside them, as well as they'll need internet connection so that they can add that information of the vaccination directly real time. Ensuring there's extension cords to making sure that the laptops don't lose all their battery. Having access to the e-form as well. And each nurse, we've been sending out a lot of information over the last little while, and I know that the Panorama team have been just totally sending it to all nurses to how to get access to your e-form. And also if their connection is an issue, making sure that there is downtime forms printed off for backup. Signage on the BCCD site, this picture here, this just shows you all the different signages that you could get. So there's COVID vaccine signages, prompts you to use the masks and sanitizer. reminders for social distancing, the clearing marked areas, the arrows, and the donning and doffing. Just need to go to the BCCD site under, I think it's Health Professionals Resources, and you'll find all of those. Actually, it's right on the bottom here. So you'll see it when you get the copy of the presentation, you'll get that too. Other resources, the BC screening tool, the aftercare sheet, information about the vaccine records are available through Immunize at FNHA. This is a copy of the one for BC showing, and community members who get their vaccine, nurses need to fill this out and give this to the client. We encourage you to make sure that the client gets this and they take it back for their second dose. One of the things that I was doing when I was doing this too, is I was actually putting the time on here of when I gave that dose, just to help them to understand when is their 15 minutes up. So just something that I did. And documentation. Is Michelle on?
I am.
Oh, awesome. Just wanted to see if you wanted to talk a little bit about documentation.
Sure. Thank you, Carol. So I'm Michelle Ham, Manager of Public Health at FNHA. And I hope you've all heard from us already, the Panorama team, around getting your e-form up and ready for use for your clinics. With so many different EMR systems across the province, the Ministry of Health brought out this e-form platform to be consistently used across the province. So it's the mandated COVID immunization documentation platform. It helps to track the inventory and supply for the COVID vaccine, and it also helps to confirm coverage rates. So super important to be getting your information. Even if you have Panorama, it needs to go into the e-form, and then that uploads into the PIR or Panorama. These are some new updates. So we're sending out a really great resource today with all of the updates, because things do change constantly, it seems, with all of the really, really good instructions. So we've worked really hard at just making it as easily understood as possible. This is the new sign-in platform for the e-form, and we were able to establish for any of the FNHA direct employees can sign in now through the First Nations Health Authority. It's a direct link to the platform. Unfortunately, we haven't been able to, IMIT doesn't know how we can do that for transfer communities, because it's a different server and connections and privacy and security. So for all FNHSO communities, they still sign in through the BC service card. So you do need to make sure you have a Chrome web browser, and then in the instructions, there's a few steps you need to do to make sure your Chrome's all set up. You need to register for your BC service card, which hopefully goes really smoothly for you. We've tried to improve our directions on how to do that. And once you have it, you're set. You don't need to do that. That's just your sign-in pathway to the e-form. And then you're good to go. So the e-form, if you have admin staff, they can, yeah, there you go, that's it. And then it's just a pairing number that confirms you are who you said you are. So it's like a high security way to be able to access the e-form. Your admin staff are welcome to get enrolled. So send us their names and fill out that enrollment, and we will get you into the platform. Admin can, if you have clinics and bookings, you can actually have them fill that information out and then save as a draft. And then if the nurse in real time has the ability to just plug in the immunization info on that client and then submit, that's a great way to do it in real time. Alternate ways that I've found are quite popular, because not all nurses have laptops where where they're working, you can fill it out by hand and then have admin on your behalf enter that information in, hopefully as your clinic's rolling, or you can save time at the end of your clinic for documenting. You do need to, the request from the ministry is that it's in real time, and that way we get accurate information when we're trying to figure out vaccine supply. That's not always possible. And if for some reason you can't get access or your connectivity isn't good enough or there's a barrier, please fill out the downtime forms that we provide and send in to the Panorama team, and we will enter no problem on your behalf. So what else? The PHN is really important. I encourage nurses, if you're doing like a poster for the clinic or when you're phoning for clients to make appointments and book their times, please encourage them to bring in their PHN. Sometimes if they don't have it or they've lost their card, they can get it off a prescription medication label, or they can phone their pharmacy that will have that information. Just because it really helps with the e-form, it populates everything based on the e-form or on the PHN, pardon me. So that's a real time saver for everybody, is to just, you know, the address and all of the demographics will populate for that client, and there's no chance of not getting the right information in. You can use it without the PHN, you just have to manually enter that information.
Hi, Michelle, it's Carol.
Yeah.
One of the things we noticed is some of in one of the northern communities, they didn't have a PA, they didn't have their PH number and they couldn't get it. So we actually used their birth date and just confirmed that way, and it helped. Yeah,
and that's totally fine. It's a little more work, but if you don't have it, then yes, you can still do it. If you're trying to submit and something's not working, or it doesn't align, or there's a question, behind the scenes, BC CDC actually has a way of, you know, that gets pulled out, and then they work through those steps. And if they can't figure it out, they send it to us, and then we connect back to the nurse and just clarify that it's the right client. So it's everybody's working on it. So I think that's it as far as my notes go. We have a great new FAQ that's going out today with all of the new updates. The downtime form, we've reverted to using the PHSA downtime form versus our FNHA branded one that we had designed, because with new changes, like now the second dose is available on the e-form, and if you're using it in real time, it will confirm that you're appropriate to immunize, and it'll show the date to the first dose. But so the changes, because they're so fast and furious, sometimes we just decided it was more accurate to use the PHSA downtime form. So great, and I'm happy to answer any questions. I do have to leave at noon for another meeting, but I'll stay on. If there's any in the chat, just put them in and I'll answer them the best I can.
Perfect. Thank you so much, Michelle. I'll cover the rest of the documentation section here, Carol. Yeah, and you can stick around after you said for questions. So we'll just leave, we'll let you go first at the end and see if anybody has any questions when we clue up the presentation. I think it's just a couple more slides here.
Great, thanks.
All right, so I just want to talk a little bit about the electronic medical records and paper charts, because some communities want to record the COVID vaccine in their electronic medical records like Mastema or something, or their paper charts. And on the e-form, there is a possibility to push a download PDF once you fill out the form, and you can create a folder in your computer to save these, and then either print them off or upload them into your electronic medical record. All right, next slide.
Scarlett had her hand up first, I think.
Okay, sure.
I'm just wondering if it was around the... Scarlett, you had a question?
I just wanted to share with the AFI, the email we had to admit for the InterHealth to submit those has changed, and because I submitted one recently using the previous email, and so there's a new one. I wanted to let everybody know because I had to delay my AFI because of that, and I can put it on the chat.
Thank you.
Awesome. That would be helpful. Thank you, Scarlett. Adverse event following immunization. This is something that you might need to use if you do have an adverse event that happens after your immunization. This form can be found at the BC CDC website. The link is right here. And there's specific criteria that would align for an AFI. And the information about that, we did do a webinar early this month, and we're going to be posting a link and sending that out around adverse events following immunizations and anaphylaxis, just so you guys can watch that. And there's also a course on the Learning Hub about this as well. All right, thanks, Scarlett. Looks like she's posted the email there. So make sure you guys write that one down. Because the adverse events actually go to Interior Health, and they are the ones that will give the advice on regarding second doses and what to do going forward with an AFI. All right, so next slide, Carol. All right, and then another form that you might need to access is the anaphylaxis form. Again, this can be found at the BC CDC website. This is something you're going to use in the event. This would also be reported as you would also need to report this on the AFI form if it did happen. So yeah, you can just go to that link to find that as well. And again, watch that webinar. It gets into details about how to do those two. And then the last slide here. So our daily reports. So this is something you're going to be doing at the end of each clinic day. There are two forms that you need to fill out. The first one at the top there, the daily report for COVID-19 vaccine. That one is one that kind of goes to central, and the second one there is for our interior regional reporting. So there's one that goes to the fax line. The fax line is also written on that reporting form. And then the second one goes to a separate fax line, or it gets emailed to that email address. So important to fill out both of those at the end of the day. All right. So then the last slide here is just a resource list. These are just some links that you can access information. This is where you can get the best information up to date. It's usually updated daily on each of these sites. All right, so I think we are ready to take some questions now. I noticed that there was one question that I wanted to address. It was about again about like allocation, I guess, around people off reserve and stuff. So again, the vaccine is for on reserve members. There are, however, a little bit of wiggle room, I think, for if the people who are off reserve, they're kind of like close to the community, and it's due to housing that they're living off reserve, and they kind of still access services and everything in community. So that can be looked at. But if we're talking about people that live in like Vancouver or Williams Lake or Kamloops, they shouldn't be coming home to get the vaccine. And it's not necessary to use all that vaccine and to get all the membership vaccinated. There will be a time for those individuals to get vaccinated. And then I also wanted to mention, somebody mentioned the rich couple or whatever. I know it was a joke, but we are also encouraging like nurses who are vaccinating that when you're vaccinating, we don't want to be the ones to be the gatekeepers. So if that kind of work can be done before the client is sitting in the immunization chair, because we don't want to create a conflict there with the nurse and the client. So if that people can be pre-screened before they get to that point, that would be really great. All right. Any questions about Panorama while Michelle is here? You can take yourself off mute. Okay, so I have a question here. So Shauna, you're asking about how did you schedule breaks for immunizers given the time frame for using up doses? For example, did you have continuous immunizing or did you stop and take a break at the same time? So it worked out in, I believe, our communities that the health center they just followed their regular schedule and closed over lunchtime, and we took a break. I believe that's what we did. You can do that, or you can also spell each other off and just create that time. If you're doing a real mass clinic and you have a large community, then each of you can take 30 minutes and the other remaining immunizers can cover that time period.
There's a question about, okay, there was mention of a staff working on reserve, being able to access a community member vaccine. I'm concerned that this was not accounted for when I calculated on reserve numbers. What should I do to address this? Well, not everybody's going to want the vaccine. And of course, it's the staff should have it, but the community members come first. But when we're getting close to the end of the day and we have a vial open and there's like 2 or 3 left over, that's when the nurse can be vaccinated. Those are the ones that should be just given, and then try to call community members in last minute, because we don't even want to lose 1 dose a vaccine because it's so precious that it's needed everywhere. So it's not like the nurse or the people are taking them first, but we are being protective so we can protect the people that we are vaccinating as well. I hope that answers your question.
Yeah, and some communities are doing like they're doing a clinic beforehand to vaccinate all staff. We're not really recommending that. Like Pam said, it's better to save those individuals in the building to use up those end of day vaccines.
Yeah, because what we found too is there was always like 3 or 4 or 5 vaccines at the end of the day, and then we're scrambling to try to fill those, to get those in arms. So, and
Yeah.
really important to have that list too of people you can call on. Maybe they're the ones that are scheduled for your second day, to see if they could come in just so you can finish up that vial.
Yeah. And everybody's been very understanding, I've found.
Mm-hmm. And that's why the CHR or the receptionist is so important, to call all those people in and trying to track them down to get them in. Because yeah, lots of times we started one, we had 7 people left, and we even stayed later, you know, just to get the last vaccine into that client in the community.
Okay, yeah, so I see Shauna is also saying here, I realize it may not be possible, but should immunizers be immunized a few weeks before the clinic? Again, we don't necessarily recommend that. There is a really great idea, like Pam was talking about at the beginning, for the advanced messaging. If you wanted to immunize like a few chiefs or an elder and a youth, and kind of just to build trust within the community, that's kind of a different idea. But yeah, I don't think that's.
You may not have access to the vaccine right away either. So there's such a short turnaround of when we're told and when you get it. So there may not be room for that as well.
And you might only get 1 or 2 days notice. Like we just you know, they just said this community is getting vaccine. We don't know ahead of time. We know the same time as you. We have like a day to travel to where we need to go, and we're there. So yeah, we have very little bit notice. Yeah.
So I don't think we're putting the nurses last in line necessarily, Colleen. It's just like the end of the first day, they'll probably definitely get vaccinated. Like we got vaccinated right at the end of the first day. And you also have to remember, like we've been in this pandemic for a really long time, and nurses are also following COVID precautions. We're wearing PPE, we have a mask on, we have eye covering, and we're also sanitizing. So the risk for us catching COVID from somebody that we're vaccinating is very, very low. Because on top of that, like usually we're physically distanced up to that 3 seconds that we're giving that, like literally putting in that needle. So the risk is low, and there's got to be a lot of space in the clinic. So I think, yeah, and I think I'm pretty sure the rest of the province was doing similar as well with the nurses. I think some of them got it at the end of the day. They weren't getting it first necessarily. I'm not sure if that's, yeah. Michelle says she's leaving now. if you have any questions for her, email her at panorama@fnha.ca and she'll be able to answer your questions.
Thanks, Michelle.
So Judy was asking too if there's a list of communities in queue for vaccine coming to community. That's a great question, and we don't know that. We're just like Pam was saying, we may find out. We pretty much find out same time everybody else does. So.
And then, yeah, we get 1 day notice if the vaccine's being moved to another community, and then we have to figure out, do they have enough staff? Do we need with them? So yeah, we're just like Lisa said, for myself and the team, is to just be ready and be ready until the end of March. So this, yeah. So we just don't know who and when. I'm not the decision maker.
Yeah, and then somebody was asking who ultimately makes the decision as to which community is next, Interior Health, BC CDC.
I think it's from my understanding, it's between IH and FNHA. They make up they suggest the priorities, they do the remoteness. Do they have outbreaks? Do they have a huge outbreaks? That seemed to be the main ones that had outbreaks and that were rural and remote, not close to a hospital or a regular health center, other than their own.
All right.
Colleen's asking why are nurses not being done right now, and again, that's all about the vaccine availability, and like we don't know when and where it's going until it's just like the day before almost. So I don't know how else to answer that, Pam.
And also sometimes if you talk to Interior Health in your area, a lot of times if you just call them up, they will be willing to vaccinate your nurse. I've seen that in some areas around here where you're able to get a vaccine. So you could try that as well. If you're concerned about outbreaks in your community, maybe, because it varies community to community. Some communities, they're not experiencing outbreaks and it's lower risk, but then other communities, like hear what you're saying, they're doing swabs and stuff. So, oops, sorry, it's my phone. All right.
The other thing too that we found is like in the Northern Statlium, they did ask Interior Health for that one vial of the 10 doses of the vaccine before they even got their vaccine, just to see if they can help do some information sharing and do those videos, just to share that, how the safety of the vaccine. That is a question that you could put forward to your local Interior Health to see if they do have that for you. It really varies though on what they have in supply as well.
Mm-hmm.
Did we answer the question from Shelley in there? Who is giving the notice, FNHA, or do we kind of?
So is she asking about like who lets them know? I think it's usually FNHA, right?
Yeah,
Interior.
Casey.
Yeah, perfect. Okay. It is being shared that we are only allowed to vaccinate on reserve only. How are other communities announcing to their membership that they will receive enough vaccines for their entire membership? I think that's just a confusion maybe in the communication. Hey, Pam, like it's not about entire membership. I think it's on reserve membership, right? So that might be just a mistranslation or a confusion in the messaging they're sending out.
Yeah, and we
Because
don't.
They're not. Oh, go ahead.
Yeah, and we don't want the members to, be traveling. Like I think Natasha said that earlier, because they've been exposed to, bigger cities and may bring the virus into the community. So we're just wanting non-Indigenous, Indigenous that live on the reserve will get the vaccine. And then the exception if they're just off and they use it, due to housing. But yeah.
Or if they're working in community.
Yeah, working there regularly, like any kind of police, tribal, tribal police or to-
Teachers.
yeah.
And you got to remember too, currently it's against public health guidelines to even be traveling for non-essential things within the province. So, and I guess you might consider this essential, but but it's not recommended.
Thanks, Scarlett.
We are currently preparing for our booster vaccine clinic for our initial clinic. The vaccine arrived at the start of the day and left the same day. So I am guessing that will be the same for our booster clinic. Although health director is advocating for change, my question is, not everyone who needs a booster will be available on day one that we have the booster vaccine. What can we tell those clients? So I'm not sure why that happened for the one day. It might be different for the second dose.
And it's not considered a booster. It's just considered the second dose from my understanding as well. And yeah, I don't know why that would either.
Yeah, it's usually a little bit longer than one day. So I'm not sure if it, like the details of your clinic, if you have a fridge or if it's being stored somewhere else, or if there is availability. I do know that eventually everybody should be able to get their second dose. So that is definitely something to be in discussion with the logistics teams. It sounds like you're advocating somewhere, so keep doing that.
Yeah, I see High Bar has no one on reserve, but members in the Clinton community. How are we acknowledged? I did mention that to Lisa that that there's nobody on reserve, so they were going to reach out to IH to see if they can provide that.
Yeah. So meaning that they will get the vaccine, right?
Yes.
Yeah.
I know that was mentioned somewhere along one of my calls, and yeah, it was going to be brought up to IH. I think Casey was going to bring it to them.
Yeah, because I think in that case, High Bar is landless community, so then they would be considered as well, right?
Tina has a question too. Is on reserve people, not just members, are eligible? Yes, it's anybody who lives in community would be eligible, whether they're members or non, and whether they're First Nations or not. If they live in community.
Yeah, the goal is to get that community immunity, right? So we want to protect that community, and anybody who's in contact with people in that community, we want them vaccinated, for sure. This message needs to be clarified with FNHA Central. I'm not sure which message.
I'm sorry, I missed part of that message.
Yeah, it's causing huge. If you could clarify, Judy, the message that needs to be clarified with Central, that would be great.
Colleen, I'll send your email to Lisa.
Okay, Shelley is saying our chief is requesting a letter from FNHA regarding eligibility on reserve non-Indigenous living on reserve staff, and that we are not allowed to share with off reserve. We are taking a lot of heat on this. I don't know, does FNHA provide letters like that, Pam?
Sorry, repeat that. I was replying to an email as well.
A letter like stating the eligibility of the vaccine. Can FNHA provide a letter like that, or like the intention of the vaccine? Because I guess
Natasha, do you mind? Can I just say something?
Absolutely.
We are really, as the frontline workers and leadership, we're the ones who are taking the heat on the decision that FNHA has made on our behalf, which I'm not in disagreement with the decision that was made. However, we need some kind of support from FNHA to address our off-reserve leadership, our off-reserve membership. Because, you know, there's that whole controversy around why are we allowing non-Indigenous people to get the vaccine when our own people need the vaccine? The other thing is, we have staff members in our community that work for the economic development arm of our organization. They have staff members that are only here periodically, maybe once a month, maybe twice a month. Now, why would we give them the vaccine when we may have somebody's daughter who visits her parents regularly, who's a band member and can't get the vaccine? These are the kinds of conversations that as health directors we're having to field. So if FNHA could give us a very clear document that defines our eligibility and what that looks like, non-Indigenous, on reserve, all of that, because it's difficult to try to maneuver this.
Okay, Shelley, can you send me an email and I'll send that out to exactly what you want, and Myra will address your concerns. And I just want to
thank you.
Okay, and I just want to also say that nurses aren't last to get immunized. We're trying to protect the elders, the frail, the elders first. And then at the end of the day, we are safe with our PPE to administer this vaccine. The nurses can be done when your clinic comes. I would assume they would all be done on the first day at some point. But yeah, so I don't disagree that they're not going to be not giving the nurses. I haven't heard of one community that haven't immunized their nurses at the clinic so far. So I just wanted to mention to Colleen that yes, the nurses will be immunized, just depending when. And if you decide that you want to do them first, then that's your decision when you get the vaccine.
I just wanted to speak to what Shelley was saying. I think it can be challenging to kind of send out like an overarching letter anyways, because it's going to be individualistic, right? Like you're talking about a family that a daughter, maybe she's caretaking for the elder, but she lives off reserve. That would be a different consideration then, right? She would be eligible to get that vaccine in that case because she is working on reserve and is coming into community. So it's like FNHA, I don't think made the decision. I think it was made even higher up, but it really boils down to the community because they're going to get those doses. We're recommending that we don't encourage people from Vancouver to come, but we can't prevent that. Do you know what I mean?
Yeah, and then there's non-Aboriginal husbands and wives that are married to the Aboriginal person, and we're still going to vaccinate them as well, and our children that are part of the family that aren't Indigenous. So there's all those kind of situations that are occurring.
Yeah.
I also just want to bring up too that the reason why we're wanting to have this, we had this meeting today is to bring light to the fact that you might not get very much time to plan for your clinic. So start planning now. That, I know that some of the communities that received vaccine, they had next to no time to start planning their clinics. So our hope is to share some of that information so that you can start thinking about where are you going to hold your clinics, who are your nurses, who are your support people, so that you can have that all organized ahead of time.
Mm-hmm. And I see Tina just said here, Carol, are we going to get a phone call like a week before? It might not be a week before. It could be a day before. Like that's just how the vaccine is moving. Sometimes a community hasn't used its doses and it's like, okay, we got to move this this vaccine right now, and it's going to your community. So it might not be a week before. So plan right now and be ready.
Yeah, because
Yeah,
also too, we have to think about the fact that when was that vaccine thawed? So that's a time that the vaccine is only good in the fridge when it's thawed for, I think, 30 days. So when did that start? And so we want to make sure that the efficacy of the vaccine itself is maintained. And I think yesterday too, I know what the All Nursings call, Bhavna brought up there's a tracking sheet for the vaccine, for basically the life of the vaccine. And I'm thinking that's going to be sent out as well, of when it was received, when it was thawed, what was the exact date and time that vaccine was thawed. So.
I want to thank you for all your great questions, and we still have like 32 new messages in there. We're going to have to copy and paste those and get back to you. It's 12 o'clock. We want to honor your time, and as we had this call booked for an hour and a half, I know that both the nurses and health directors are very busy in their role. I know meeting after meeting, but if we miss and you don't hear back from us, just let us know, and we will answer your questions, and we will forward anything to my supervisors, Lisa Montgomery Reed, the regional executive director. And I didn't introduce myself this morning because I always assume that everyone knows me. I apologize. I'm Pamela Crema, the regional nurse manager in the interior for FNHA. So we thank you for your time. Unless there's something burning that you want to just say right now or comment on, go ahead. Oh, and then there's someone said, just to be clear, we'll get a phone call day before or a week before to tell us how many doses we'll be receiving so that we can book that many appointments. Casey's pretty good. He'll try to give you the most time that he's able to give it, because sometimes we have planned, and also notice that it is delayed sometimes. We were waiting for vaccine to be delivered, and of course Europe didn't send it out, so then we had to wait a couple of days. We were ready to roll it out, so there's all kinds of logistics issues, and I have to give kudos to Casey for dealing with all of this, because nothing is ever on time or are always organized. We're just working as we go, and we have so we're still learning here, and it's going to take some time to get everybody done, but like Lisa says, by the end of March, hoping that we will be completed.